Good morning, Scott. Jeff Bourgeois here. How are you today?
I am well, Mr. Bourgeois. Thank you for calling in as you always do with us, and we appreciate it very much. I'm flying solo today, so there's no Megan, just me. But we'd love to get an update from you on conditions at the hospital this week. What can you tell us?
Well, let's start with some good news. How's that?
I love it. Yes, sir.
Okay. So if I look back at our records, the first week of January, and going back also into the last week of December, we really were at a peak in terms of our test positivity rate for both our 7 and 14-day rolling averages. They were right at 27%. We've seen a steady decline such that now our 7-day rolling average is right at 10%. Our 14-day rolling average is down to 12%, and they've been trending down since roughly January 7th or 8th. So that's good positive trend. Eventually, that should translate into fewer hospitalizations for COVID-19. What we're seeing right now is we had just ever so slightly of a decrease, and then it really leveled off. So we have a very heavy census today for COVID and non-COVID patients. Very busy hospital. 70 COVID positive patients with another 13 patients pending test results for a total of 83 COVID-19 patients or patients under investigation. A total hospital census of 173. That's a busy hospital for us. We do have 10 of our COVID patients are intubated. A total of 12 of them are in the ICU, and then we have another 4 non-COVID related intubated patients. And so we are watching our test positivity rate closely, and as I mentioned, anticipating that should convert to a lower COVID-19 hospitalization experience here for us if that positivity rate continues to decline.
Right. Well, and we hope it does, Jeff Bourgeois. But as you mentioned, a very busy hospital that seems almost to be pretty full from the numbers that you shared. And you, I think, shared with us last time we spoke that some other hospitals maybe not experiencing quite so high numbers. And so, again, those patient transfers, if you needed to make extra room, that system is still working well. And those other hospitals have some capacity that can maybe help relieve the pressure a little bit on San Juan Regional if need be.
That's exactly right. Suzanne Smith, our chief nursing officer, and I completed our regional hub check-in call where we visit with 6 other hospital leaders across the state who are also considered hub hospitals like us. So hospitals from Cruces, Albuquerque, and Santa Fe. And we only experienced 2 transfers in yesterday. They were both for non-COVID related reasons. And then we also had 1 transfer out of our hospital yesterday also for a non-COVID related reason. It needed a higher level of care, so that patient was moved into one of the Albuquerque hub hospitals. But that system is still working very well, Scott, and our partners in the other hub hospitals are really helping us. So I know Suzanne and a couple of those nursing leaders were going to visit today to talk about potential transfers if we needed them. Statewide, overall hospitalizations, as you referred to, have decreased this week over last. So statewide, there are now less than 600 COVID-19 patients hospitalized, which is great news. We bumped up a little today from yesterday, but still below 600.
Good to know. And I just want to make sure our audiences understand, Jeff Bourgeois, when you mentioned the numbers of COVID patients, at the hospital, that certainly is a smaller number compared to the number of patients that the hospital is treating. You have the COVID to home program and things along that line. So we have a lot of other COVID patients in our community that are still getting attention from the hospital, even though they're not within your 4 walls.
That's a great point, Scott. Thanks for mentioning that. We couldn't be more proud of our caregivers who helped us stand up the COVID to home service here. It's now a model statewide. As of the beginning of this week, we had 82 patients enrolled in that. And then we also continue some outpatient infusion therapy clinics for COVID patients with the BAM and remdesivir outpatient infusion therapies.
Very good. And just briefly, Jeff Bourgeois, before I let you go, I wanted to ask a bit about the rollout of the vaccines. Of course, San Juan Regional Medical Center has been a partner with all the other entities that are helping to make this happen, from the Department of Health and the County Office of Emergency Management, and certainly it's been rolled out to your folks, and the number and the audiences are expanding throughout our community, which we're so grateful for. But I guess so far so good is my question for you as far as the vaccine rollout is concerned.
Well, for the inventory we have, yes. The numbers I heard most recently is that we have vaccinated a total of 1,800 individuals with both doses, and then a total of, inclusive of that 1,800, a total of 3,000 who've received their first dose. So I guess what would that be? Another 1,200 in line for their second dose once the necessary time is passed. We're following the state rules and following state guidance with respect to the phase 1A and phase 1B, and there's only certain components of phase 1B that are eligible right now. Those elder, over 75, and then 16 plus with risk of complications. So we're following those rules closely and paying attention to what the state's guidance are. The state, to their credit, it really has to, like us, they'd like to open up the vaccine pipeline to everyone as quickly as possible. The challenge is the inventory or supply of vaccines that come into our state. So maintaining the position to vaccinate the most vulnerable populations first with the inventory that's available in the state, and then roll it out to broader distribution once more inventory becomes available.
Right.
So, I think there's a lot of questions and just confusion about what's going on, and really the rate limiting factor for our state is the amount of vaccine dose arriving in the state. I think we are number 3 or so in the nation in terms of the amount of vaccine we have used compared to the amount we've received, and we're close to 77% administration rate. So great work among all the agencies in the state to get out the vaccine doses they do have.
Very, very true. And it sounds like maybe those numbers of vaccines that are coming into our state will be increasing. At least we hope they will be in the coming weeks. And hopefully the system that's in place will be able to ramp up as well as those supplies increase.
Yeah, I think the system is in place. And last week, UNMH vaccinated over 8,000 people at the pit down in Albuquerque. And,
wow.
They've had to slow down this week just due to the amount of doses they have. So they've got a wonderful system down there. Our colleagues here in San Juan County, we're ready to go and help in whatever way we can. We just need the supply.
Exactly. Well, it's hopefully hopeful news that we are hearing from you this morning on a number of fronts, Jeff Bourgeois. And so, again, we appreciate you calling in. And again, we so appreciate the staff at San Juan Regional. When you talk about these large and high numbers and the busy hospital, it falls on the shoulders of all of your healthcare workers there, and we do appreciate their efforts immensely.
Well, thank you for saying that, Scott. That is so important, and that's what they need more than anything is just appreciation from all of us for the just truly tremendous work they're doing over what has been a prolonged second wave of this pandemic. So they're true heroes in my mind, and I'm just proud to be associated with so many excellent individuals.
Well, we are too, and through you, and we appreciate that, Jeff Bourgeois. Thank you for calling in, and stay well.